Set 3 CDASH Technical question and answers. Answers are highlighted in green. Question 1. Data consistency. A study requires you to collect adverse event start date, AE start date and end date, AE end date for all reported adverse events. What is the best way to ensure that the dates are collected in a format compliant with the CDASH standards? Now, all those people who know the CDASH standards, the correct answer is collecting both the dates in the ISO 8601 format, right? Which is YY DD format. Now those people who do not know the answer, I will just try to explain here. Is option A says collect both dates in DD YY format. This is not the correct answer because it does not follow the CDASH standards. Now collect both dates in free text format. This is also not the right answer. The reason is you cannot add the free text format in your CDASH standards, right? It does not fall in the CDASH standards. Option D says collect dates in any local standard format used in the study's location. This is also not the right answer because the CDASH standard says that both the dates should be in ISO 8601 format, which is DD format, right? Question 2. CRF design. A clinical trial requires collecting vital signs for heart rate, blood pressure and temperature. According to CDASH guidelines, how should you name the variables to ensure compliance? Now, if you know the CDASH guidelines, the answer is C, which is VSORRES for all results, and you have to use the VS test to describe the specific test. So this is a variable where your original values will be collected and will be entered. The option says HR, BP and temperature. So these is not the correct way of naming the variables as per the CDASH guidelines. Now this talks about VSSRT for heart rate, VSORRES for blood pressure and this particular variable for temperature. So this is also not the right variable names as per the CDASH or the CDASH guidelines, right? The option D says any naming convention as long as the data is recorded in the database. No, you cannot put the naming convention as per your convenience or as it is recorded in the database because you have to follow the CDASH guidelines, correct? Question 3. Visit numbers. In a trial, visit 1 and visit 2 data are incorrectly entered with overlapping visit dates. According to CDASH, how should you address such discrepancies? Now the correct answer here is C, which is correct the visit dates and provide clear documentation in the audit trail. It is very essential that whenever you address any such issues which are incorrectly entered into the visit dates, especially which are related to the time points or the protocol scheduled assessments, those kind of are very important and the key variables, and you should also have a clear documentation and the audit trail, right? Now option A says leave the data as is long and flag it liver fail. No, you cannot add the data as is and you cannot flag it as for review later. You have to review it now before the database log. Remove visit to data entirely. No, you cannot remove any kind of visit data in the clinical trial study. The option D says combine data from visit 1 and visit 2 into a single visit entry. No, you cannot do such kind of manipulation in clinical trial data. This will conclude that you are doing biases and you're playing with the data. So the correct answer is C. Correct the visit names and provide clear documentation in the audit trail. Question 4. Supplemental qualifiers. A specific trial includes custom data points that are not part of standard CDASH domains. How should you handle these additional data points in compliance with the CDASH implementation guide? So the correct answer is B here. Create a supplemental domain to capture the additional information. Now, if you have read the CDASH implementation guide, the supplemental domain which starts with DM, SUPP or SUPP DM kind of naming convention. So you have to follow this as per the guideline. Option A says add them to the CRF without any documentation. No. In clinical trials, wherever you are dealing with the human data or the human live real world scenario data without documentation, you cannot add them into the CRF. Documentation is a key integral part in clinical trials to maintain the records. Option C says replace existing CDASH variables with the custom data points. No, you cannot replace any CDASH variables with the custom data points, because if you do that, you are not in compliance with the CDASH implementation guide. Option D says ignore these data points to maintain CDASH compliance. No, you cannot ignore any data points whenever you are dealing with clinical trial human data. Question 5. Coding standards. Which coding standard is recommended by CDASH for categorizing adverse events? Now, as you know, WHO drug dictionary is not the right answer. Then Sinomed CT, I don't think there is any naming convention in clinical trial as any guidelines, especially as far as my knowledge goes. Then option C says ICD. Then even I am not aware of such guidelines, especially in the CDAS guidelines. So the correct way of doing the coding standards for the adverse events is nothing but the MEDRA. So all those people who know are working in the industry, they know that we use MEDRA coding for adverse events. Question 6. Data collection tools. In any electronic data capture ADC system, what is the primary requirement to ensure compliance with CDASH data collection standards? Now, the correct answer is the EDC system must support CDASH compliant variable naming and formats. Now, as you know, you are talking about the CDASH data collection standards. So, it is quite obvious, and it's a quite common sense that EDC, right, should support the CDASH compliant variable naming format. So the answer itself is in the question. So the option A is the EDC must generate data in a tabular format. No, you cannot do this. The EDC system must automatically generate SDTM datasets. No, this cannot be done automatically. You have to write the SAS programs through SAS valid license software, and then you have to validate under Pinnacle 21 software, and that's how you generate the SDTM datasets, which are error free and which has no errors and warnings in the Pinnacle 21 software. Now the EDC system must allow free text entries for all fields. No, you cannot allow any kind of free text entries in any of the fields in the CDASH data collection standards. Question 7. Protocol deviation collection. A study sponsor requests the collection of protocol deviation. According to CDASH standards, where should protocol deviation data be stored? Now, the answer itself is in the question. So, the correct answer is in the PD, which is your protocol deviation domain. It cannot be in adverse events, because adverse events is dealing with your side effects or some kind of diseases. So this cannot be. The protocol deviation is nothing but any deviation, like say for example, in a protocol there is a specific assessments that on this particular date and at this particular time this kind of measurement should be taken. Now if that measurement is not taken as per the scheduled time in any clinical trial study, it relates to deviation, right? So that is why it is called as protocol deviation. Now option C says in a separate spreadsheet not linked to the CRF. No, you cannot do this. In the demographics, now the question of demographics does not arise here, right? Because we are dealing with the protocol deviation. Protocol deviation domain is different and demographics domain is different. In demographics, we collect simple data for a human that is related to age, sex, gender, and blah blah blah, all such kind of variables. So in protocol domain deviation, we use protocol deviation domain. Question 8. Data mapping challenges. During a trial, a concomitant medication was mistakenly recorded in the medical history MH domain. How should you resolve this to remain CDASH compliant? Now you have to reclassify that record into the CM concomitant medication provided with proper justification. Now if a concomitant medication was mistakenly recorded, that is fine. Humans can do mistake, but you have to reclassify it with appropriate justification. Now this justification also has to be very rational, and each and every point should be mentioned in the audit trail and in the records, and it should be documented. Leave the data in the MN. No, you cannot leave such kind of wrong records in the domain. Create a new domain for the medication. No, you cannot create a new record or a new domain for that specific medication. You have to reclassify into the CM domain. Option D, remove the record and do not include it in such database. No, you cannot remove any kind of record that has been captured in CRF as per the clinical trial study whenever you are dealing with the human patient's data. Question 9. Missing data handling. If a patient refuses to provide their race during a clinical trial, how should this be recorded to the CDASH guidelines? Now the correct answer here is enter not collected in the race field, right? You cannot leave the field blank. Okay, you cannot enter as unknown in the race field, right? And you also cannot remove the patient from the study. Even if that patient has withdrawn before giving the study drug, you still cannot remove that patient from the screening kind of CRF or the screening kind of information, right? In the specific clinical trial. So any patient who refuses to provide their race, you can simply enter as not collected in a very diplomatic way. Question 10. Reuse of CDASH CRFs. You are designing a new oncology study. What is the most efficient way to ensure CRFs comply with CDASH standards? The answer here is you do reuse existing CDASH compliant CRFs and customize them for the study. Option A says design CRFs from scratch using study specific guidelines. No, you cannot do this. Whenever you are designing a new oncology study, the most efficient way to ensure that CRFs comply with CDASH standards is reuse existing CDASH compliant and customize them. Then the option C says use a generic template without. No, you cannot use this. You have to always use CDASH variables if you want to comply with your CDASH standards. Option D says collect data in free text format for standardization. No, free text format is never allowed, especially whenever you're dealing with the clinical trial data and wherever you are dealing with the human patient data. Free text is only allowed in the comment section wherever you are designing the CRF, right? Please like, share and subscribe. Leave a feedback comment mentioning any topic that you want me to make a video. Looking forward for a positive response. Thanks for watching. Please like, share and subscribe. Leave a feedback comment. Many thanks for your support and having great connection.